Hello, everyone. Dr. Jack Wolfson. Jump into the chat box, say hello. Welcome to my presentation tonight. That is a very important topic. It's a centuries and millennia, and really it's a problem since the beginning of human existence, but it's certainly worse over the last 100 years. And again, as we get into a world where there is more environmental toxins and pollutants, it is no surprise that this issue is really coming to the forefront. So I appreciate you being here. Jane, Barb and Tim, Pam, Donna, great to see you guys. Jump in, say hello. Sheila, again, appreciate you all being here. Lots of familiar names. Melanie's in the house. Beverly, again, if I don't say hello to you while you're here, I do apologize. I mean no slight. Jeff Mann's in the house, and I'm sure Randy's there as well. Alice, hello. Colette, again, thank you all so much for being here on a Sunday evening. We are in Colorado right now, so it is 5 p.m. our time, and we're going to let a few more people log on. Give me about 45 minutes. Lori, Trisha, Monica, great to see you, Lori. Tamara, hello. Debbie, Brad, great turnout. Again, I appreciate you all being here with me tonight. And I will turn on my video so you can see it's me. Hello to everyone. And I'll be staring at my screen, so not necessarily at the video camera. Chat box is open, 45 minutes. Replays coming. So if you don't get it all, because I'm going to give a lot of evidence, not so much like deep science per se, but certainly a lot of evidence. And we can go as sciencey as we want, and we'll save time at the end, of course, for a Q&A. Patrice, great to see you as well. Lizbeth, again, a lot of familiar people on the call, which is awesome because I love all of you and I appreciate you all being here. Dennis, hello. Okay, so let's get started. So tonight's topic of conversation is called mycotoxins, the cardiovascular connection. And I'm going to go through some fantastic material that you need to know when it comes to health and wellness. All about mycotoxins. So don't worry, I'm going to teach you what mycotoxins are, tell you why they're a problem, because cardiovascular disease is the #1 killer in the world. And that's why I do what I do to prevent, treat, and reverse cardiovascular disease naturally while reducing and eliminating pharmaceuticals. That's what we all do at Natural Heart Doctor. You see, everyone deserves the 100-year heart. And heart disease is the #1 killer worldwide. Millions of heart attacks every year, millions of strokes, millions suffer from atrial fibrillation, congestive heart failure, hypertension, cardiomyopathy, you name the diagnosis, and people are suffering. And what does this lead to? Mainstream medicine, their quote unquote solution is trillions in pharmaceuticals and medical procedures. And I should know because I did that for 16 years. So their solution are pharmaceuticals. My solution is to find the cause. And as we get through the cause tonight, you're really going to see why this is so important. Now, again, your traditional medical doctor is not going to know what we're talking about tonight, but I'm going to show you the evidence, and you're welcome to share this video, which will be uploaded onto YouTube as well. They will be able to see it there should your doctor want to watch this. So over here at Natural Heart Doctor, as we become doctors of cause, whatever your ailment is, whatever you're concerned about preventing, whatever you currently are suffering from, we start off with the philosophy of eat well, live well, and think well. And we've talked about eat well and how we eat, and we're about to dive in tomorrow into the 100-year heart challenge, which is a fantastic eating program and sometimes lack thereof with intermittent fasting. It's a lifestyle program as well, mostly talking about eating though. Live well are all those tenets of sunshine and sleep and physical activity, but it's also about avoiding environmental toxins and pollutants. And then ultimately think well. How do we think well, get our mind right, find our happiness, find our joy in life, and get rid of the anger and the stress and anxiety that plague society? So are you suffering with any of these conditions? Take a look at everything that you see on the screen there. We're talking about palpitations, fatigue, issues with weight. Either you have too much weight or you feel like you're underweight. You struggle with sleep. Maybe you have brain fog, skin problems like eczema and psoriasis, atopic dermatitis, itching, gut issues, reflux, heartburn, diarrhea, constipation, abdominal pain. So that's the non-cardiac stuff. And over on the right, we've got things like high blood pressure, abnormal cholesterol, coronary artery disease, atrial fibrillation, cardiomyopathy, heart attack, strokes. It is all here in this area. And I want you to know that as mainstream struggles, and really they don't even look at what the cause is, I want you to know that maybe your symptoms are from mold mycotoxins. Mold mycotoxins, and I'll explain what these toxins are in a second. But mold, as I said, has been a millennia-old issue. Of course, mold has been here for a very, very, very long time on this planet, and humans have been around during that time. The difference is, of course, is that the building structures are now different. The sickness is different. The foods people eat are different. The electromagnetic fields and other environmental toxins like pesticides and phthalates and parabens and VOCs, all these different things can all stack together, but mold mycotoxins are a fundamental problem. So I want to tell you real quick before I describe what these toxins are, I want to tell you about my patient, Wendy. Now, Wendy was doing fantastic. She came to see me originally from the Bahamas. She had cardiovascular issues, including a mechanical heart valve. She was doing fantastic. We got her off all of her pharmaceuticals except for the anticoagulant Coumadin because of her heart valve. We couldn't remove that, but we were able to reduce the dose, and she's doing fantastic. And then she called me brain fog, racing heart feelings, skin issues, digestive issues, weight issues, sleep issues. I said, Wendy, what's going on? Did anything happen? Did you get some kind of infection? Did you start a pharmaceutical? Did you travel somewhere? Were you under more stress? Are you in a new home? And she said, oh, well, actually, we are in a new home. And I said, well, we got to get you tested for mold mycotoxins. And what we found when we tested her were sky-high levels of mold mycotoxins, and we were able to resolve her symptoms by working hard to get rid of the mold mycotoxins from her life and out of her body. Now, the mycotoxins impact the cardiovascular health. Again, mycotoxins are proven to lead to each one of these diagnoses on this screen. It is in the medical literature, and I'm going to break it down. So no matter what you're suffering from diagnosis-wise, or you've had a blood clot, DVT, pulmonary embolism, chest pain, shortness of breath, you name it, it can be from mold mycotoxins. A little bit about me. I'm Dr. Jack Wolfson, former senior partner in a large cardiovascular group, director of cardiology and medicine and cardiac rehab, Phoenix top doc in 2011, top 50 functional medicine doctor, 5-time top holistic MD, international speaker and author, founder, naturalheartdoctor.com. And again, our plan here for you, our goal, our mission is for everyone to achieve the 100-year heart and beyond. Everybody deserves the 100-year heart and beyond. Here's a couple books that I was involved in. On the left is a integrative cardiology textbook. On the right is my book, The Paleo Cardiologist. And we have tens of thousands of copies that are out there in the world, and they've done just so well by, for people. So again, in this presentation, I'm going to tell you, again, fungus among us, where does the mold hide? What are these mold mycotoxins? The symptoms people suffer from during mold mycotoxin toxicity, how mycotoxins damage our health and specifically our heart health. And I'll be talking about brain as well. So if you know someone suffering from brain issues, they should be tested for mold. And again, how to diagnose this mycotoxicity. So mold itself can be present anywhere in your home where there's water. Now, many people talk to us out in Arizona, or they come out to Arizona and or they live in Arizona, and they say, well, we live in Arizona, we live in Colorado, we live in Northern California, we live in these dry climates. How could we possibly have mold? And my response is very simple. If you have running water, you can have mold. All you need is water and a surface for the mold to grow on, and you can have mold. It doesn't matter if your house is brand new. If your house is 50 years old, 100 years old, you can pretty much guarantee that there is mold mycotoxicity that is at play. Now, again, the common places: under a toilet, under a shower, under a sink, under your dishwasher, under your laundry machine, inside your laundry machine. When you don't open up the door of the laundry machine, it gets moldy. You know that mildew kind of smell? That is mold, and mold mycotoxins being released into the air, and that's what you're breathing in. That's what you are smelling. It can also be in indoor plants, so we need to be very careful about the amount of water that is in a plant to make sure there's not too much still water that is in there. Anywhere, again, air conditioning systems are famous for this. Even, we've talked about how a tree that maybe you cut down, a Christmas tree, or it's a real, was live Christmas tree, after 72 hours, it starts to produce these mold mycotoxins. And this is interesting here, on the screen, where on the right-hand side, about 3 o'clock, is this kitchen sink disposal and cracks in grout sealant. Very, very common for it to occur there. The obvious thing is, if you've had a flood previously, you can bet that there is either current mold going on, but certainly previous mold mycotoxins that have been there. So what are these mycotoxins we keep bringing it? Well, mycotoxins are a group of compounds, these molecules that are produced by the mold. And the mycotoxins are meant to get rid of things that could interfere with the success of the mold. So mold wants to survive. We've got teeth, we've got claws, we can run, we've got things that we can do to protect ourselves when under danger. How does mold ensure its success? Against viruses, against bacteria, against parasites, against insects, against animals, and against humans. It releases these toxins into the air. Now, these toxins we can think of as like the Army, Navy, Air Force, and Marines. They are just being released out there, and they are meant to stop things from harming the mold, and humans would fall into that category. Now, like most terminology, it comes from the word Greek as far as mycos, which is fungus or slime, slimy molds, and obviously toxicum, referring to toxins. The Greeks were the founders of modern medicine. Their role is to communicate and compete with other organisms or to inhibit competitive growth and reproduction. Over 300 different types of mycotoxins are known. Over 300. Now, in the test I'm going to tell you at the end, we test for over 30 of these, but there are hundreds more than even the most advanced and in-depth test that I will tell you about. There's no other test that's as complete as what I'm telling you here. Now, this is not necessarily, we're talking about mold allergy. We're talking about mold sensitivity. We're talking about possible allergy from the mold, a lot of different things. It's not that, and some people, again, they don't have symptoms from the mold. They may be in a mold mycotoxic environment. They have no symptoms, but their first symptom is a heart attack, or it's a stroke, or something similar. And again, if we think about young people, the ability to lead to fertility issues, hormonal interference, you name it. So again, here's some of the most common complaints of people in this. It really starts off with water damage. So water damage then leads to mold mycotoxicity and this poor indoor air quality. And if you look at this, again, it's a laundry list of symptoms. I'm telling you again for the fifth or sixth time, no matter what your symptoms are, think about what your symptoms are. Whoever is on this call, whatever your symptoms are, if it's weight, if it's fatigue, if it's insomnia, if it's low libido, if it's skin issues, if it's cardiovascular issues, I'm telling you, mold can play a role, and I'm going to show you more information in a second. Now, these diseases that people have related to water damage, building, and poor indoor air quality, the mold mycotoxicity, it's beyond cardiovascular. It gets into cancer. It gets into lung related. It gets into the skin. It gets into neurologic issues. My father, if you don't know, died at the age of 63 from a Parkinson's-like illness called progressive supranuclear palsy. I have no doubt that we had mold in our home growing up. I'm sure the exposure from when he was a child, as he grew up in the East Coast by the ocean for that matter, he undoubtedly had mold mycotoxicity. And because mold mycotoxins can be in any problem or in any home, even as we moved into a newer home in Chicago for the 90s, and early 2000s, he still would have had exposure. It's unfortunately, it's a fact of life, but we better do something about it. Otherwise, you suffer with these conditions. People with multiple sclerosis, gastroenterologic issues, whether it's heartburn, reflux, colitis, abdominal pain, liver inflammation as well, autoimmune, thyroid issues, and others. And then, of course, diabetes, obesity, fertility, and mental health issues as well, right? Anxiety, stress, anger, depression. What role do mold mycotoxins play in this arena? Now, these mold mycotoxins, they get in through our lungs as we breathe them in. They get in through our skin, and they also get in through our gastrointestinal tract, whether they're on our hands, on our food, in our food. We are, again, exposed not only from our personal environment, but also from some of the foods that we eat is where we get these mold mycotoxins from. Now, again, the mechanisms of mycotoxin cardiotoxicity. So what does this mean? Again, the mycotoxins lead to cardiovascular issues, and these are some of the reasons why. And I'm going to go through this a little bit more in depth. Not every one of these, don't worry, but a lot of them, certainly. Leaky gut, we'll talk about that. Mold mycotoxins lowering glutathione, leading to inflammation, oxidative stress, and damaged oxidized lipids. We'll talk about that. Interfere with the endothelium, the lining of the blood vessels. LDL receptors, the catcher's mitts that remove old LDL out of circulation. If we can't remove the old LDLs, we're going to let them continue to circulate and they will deposit in arteries. Apoptosis, which is cellular death. Inhibition of DNA synthesis, the cells can't replicate. RNA, we can't produce proteins. We decrease nitric oxide production, so our vessels get smaller, leading to angina, leading to hypertension, leading to other cardiac issues, leading to immune dysfunction, mitochondrial dysfunction, autonomic dysfunction as well. Autonomic means high heart rate, low heart rate, high blood pressure, low blood pressure, fast heart rates and slow heart rates alternating, all of it. So we talked real quick about this leaky gut and the intestinal hyperpermeability. So what happens is that when we have this leaky gut, so these things get into our body that don't belong. So we've got toxins, including mold mycotoxins. We've got other bugs and infections and viruses and bacteria and parasites. And then we've got foods and things like gluten and undigested food proteins, you name it. So they damage the intestinal lining. They get in through the intestinal lining. They get into the body, and the body doesn't understand what they are. They don't belong there. So they're foreign invaders. So the immune system activates. Bottom left, the inflammation and oxidative stress happens next. And now all cardiologists know that inflammation and oxidative stress are bad. But what they don't know is what's causing it. And that's what we have to do. Because if we think that we're going to use aspirin or statin drugs to help with the inflammation, we're going to fail. We're not going to do right by our patients. Sure, some studies show that statin drugs on a whole can lower your risk of having a heart attack or stroke by a tiny amount, but that's not good enough for you. That's not good enough for the 100-year heart. This is what we're trying to do here. So understand, again, this concept of intestinal hyperpermeability or leaky gut. Now, again, things get into the body that don't belong, and I'm going to show you how mold mycotoxins lead to that. Now, we do know that intestinal hyperpermeability, and I've got the references there on the slide. So this is not theory. This is not conjecture. This is not something that I learned in medical school, but I've learned it over the last 10 to 15 years. And a lot of it's in the literature as it relates to intestinal permeability and coronary artery disease, high blood pressure, high cholesterol, even congestive heart failure. And the article you can see on the screen there for congestive heart failure, that goes all the way back to 2007 as it relates to this intestinal hyperpermeability, leaky gut. Now, we can actually test for this. We do run this test in our office. It's called the Wheat Zoomer by Vibrant America, where we test for intestinal permeability and couple these markers here like this anti-actin antibody. Now, over the last 2 years, everybody's become an immunology expert. Everybody wants to know about antibodies. Do you have antibodies to COVID? Do you have, did the shot lead to antibody production? Did the natural reaction to COVID lead to antibody production? So this particular test shows high antibody activity to this protein called actin. And over on the right-hand side, it's a busy depiction, but all the way at the bottom, you can see those red balls of actin, very critical when it comes to muscle function, but not only skeletal muscle, but also heart muscle and blood vessel muscle. The immune system is attacking it. And again, that is coming from mold mycotoxins. I'll show you that in a second. Anti-actin antibodies. So again, these antibodies that are being produced, they lead to carotid disease. And if they're damaging the artery in your neck, I assure you they're damaging the artery in your heart. Mycotoxins interfere with the actin protein. So again, if your muscles are trying to contract and relax and contract and relax, it depends on this actin protein. And this study from 2008 showed that mycotoxins interfere with the function of the actin protein. And that's why in 2020, this journal came out where it talked about intestinal barrier dysfunction as a therapeutic target for cardiovascular disease, something I've been talking about since 2005. But now they're coming out with, these doctors here saying, again, they're looking at the intestinal barrier as a therapeutic target for cardiovascular disease, something I've been doing for well over 15 years. So what causes the leaky gut? Obviously, a lot of things cause leaky gut. We talked about food. We talked about environmental toxins and the mold mycotoxins, effective mycotoxins on the intestine from the journal Toxins in 2019. So the mold mycotoxins lead to leaky gut. If you've got gut issues, heart issues, you need to know if you're getting poisoned from these toxins. Mycotoxins cause leaky gut. 2017, Archives of Toxicology. 2014, this particular mycotoxin that we test for is a trigger for intestinal integrity breakdown. So a lot of the medical community are finally waking up to this particular issue, but we are still way behind. Now, if you've heard me talk before, you know how much I discuss glutathione. I'm a big fan of glutathione testing. I'm a big fan of replacing glutathione, increasing glutathione because of what glutathione can do. Now, here's what happens is that these mycotoxins in this scenario, they lower the glutathione, they lower the body's ability to make glutathione, they lower other antioxidant enzymes, catalase and superoxide dismutase as well. So we do not want to be exposed to anything that's lowering our glutathione levels. Glutathione and cardiovascular disease. So why am I so concerned about your glutathione levels and how mold can lower glutathione levels? because low glutathione leads to a much higher risk of cardiovascular disease. So here we've got the study from the American Heart Association where it showed people with the highest level of glutathione have 75% lower risk of cardiovascular disease, heart attack, strokes, and dying. So we need to know what your glutathione levels are. We test for glutathione inside of the Vibrant Micronutrient Test. So this particular one called aflatoxin B1, how it particularly damages heart muscle cells. This is from 2017. Again, impaired mitochondrial function. So the fuel factories of the cells that make energy, that do some phenomenally interesting and intricate things of what mitochondria do. So again, aflatoxin B1 interferes with that. It leads to ROS, reactive oxygen species, which is producing oxidative damage, which is your body rusting. All of the cells, all of the membranes, all of the tissues are, in short, rusting. Rust is what happens when metal oxidizes, and disease in the human body is what happens when cells, tissues, and organs get oxidized. And in this scenario, aflatoxin B1 induced apoptosis. It kills heart cells. So if you're suffering from cardiomyopathy, for example, if you're suffering from atrial fibrillation, these are things you need to know. Now, this is kind of a cool concept here, is that oxidized LDL. So we're talking about how the mycotoxins lead to oxidative stress. And now when the LDL particle, which is very beneficial, the medical community, the pharmaceutical community, they've told us that LDLs are the bad cholesterol. Not true at all. LDLs are vital for life. But when they become damaged, that is when the problem starts. So an oxidized LDL is taken up by this receptor called LOX1. And that is the start of things like vascular smooth muscle cell issues, macrophage inflammation issues, endothelial cell issues. So we do not want these oxidized LDLs, and we test for these also inside of our advanced cardiovascular panel. Mycotoxins and lipids. The mycotoxin that are, again, they're released, they get into our bodies, and what they do is it interferes with the LDL receptor. So the LDL particles floating around, they can't be cleared by the LDL receptors, the catcher's mitts on the liver that pull those old LDLs out of circulation. And then I'm also going to show you how they interfere with HDL function. So there's, again, I talked about in red, you can see these receptors, LDLR, and how they catch those olive-looking things called LDL particles. They're the catcher's mitts in the liver. The liver makes LDL and it removes LDL. But if it's not removing the LDL, it continues to circulate, gets smaller, gets more damaged, and then it is targeted by the immune system and it gets taken up by blood vessels, leading to coronary artery disease, coronary artery calcification, heart attack, stroke, and ultimately death. So we know that mold mycotoxins cause those issues. We see here how this thing called ABCA1 that removes old cholesterol from the body that's no longer necessary and puts it onto an HDL. Now, the ABC1 protein does a lot of different things, in addition to what I just said for HDL. Just trust me on this one, and you can go back, and if you're interested in doing more research on how this ABCA1 is involved with the pancreas and insulin, what it has to do with obesity, what it has to do with liver function, what it has to do with eye function, including age-related macular degeneration. One of the leading causes, if not the leading cause of blindness in older adults. Now, these people here, they know high cholesterol levels and chronic exposure to toxigenic molds and damp buildings. It's getting mainstream. More people are talking about this. This was a very interesting case that I saw. 64-year-old male with cardiomyopathy and an inflammatory condition called sarcoidosis. His ejection fraction was less than half normal at 25%. He already had a defibrillator placed. He was on 8 pharmaceuticals when he came to see me, and he was currently under the care by the worldwide experts in cardiomyopathy and sarcoidosis from the Mayo Clinic and UCLA. So get this. Now, again, when it comes to those doctors, Mayo Clinic, UCLA, and even from an online site like Medscape, sarcoidosis is a multi-system inflammatory disease of unknown etiology. Unknown etiology. Ready? I'll tell you what. I tested this patient and I found that he was high in Fusarium, which is from water damaged building, Stachybotrys chartarum, water damaged building, Aspergillus and Penicillium. This can also be from food, can also be from water damage. So I found that he had mold mycotoxins. And what we saw, it went into the literature, and check this out from 2011. Fungal exposure in homes of patients with sarcoidosis, an environmental exposure study. So the fungus is in the homes of people with sarcoid, but the Mayo Clinic doesn't know it, UCLA doesn't know it, and Medscape doesn't know it. And now the patient knows it, and of course I know it, and now you know it. It's interesting too, is that as though they don't know causation, I found this study from way back in 1992 that showed that Borrelia burgdorferi, which is the parasite that you would get from a tick bite that would lead to Lyme disease, how Lyme leads to sarcoidosis. And we do Lyme testing in our office as well through our advanced tick-borne panels at Natural Heart Doctor. So the Mayo Clinic, again, UCLA, they don't know. And now this guy knows. And we're on the way to marching him off his pharmaceuticals and doing well. Here's another one, citrinin. And again, the same thing, how it disrupts RNA, DNA, nitric oxide, leading to cell death and a lot of inflammation for citrinin. Now, citrinin is also a well-known inhibitor of cholesterol synthesis. This has been known since 1976. Citrinin inhibits cholesterol synthesis. You may know of this as the first statin drug called lovastatin. Lovastatin was derived from citrinin, and citrinin inhibits cholesterol synthesis. Of course, lovastatin does. But while this mold mycotoxin citrinin is inhibiting cholesterol synthesis, it's also all the things that are on this chart, and it's inhibiting all these different things from occurring that are necessary, just like statin drugs inhibit things like CoQ10, something called Dolokal, which is a very important fatty steroid-like molecule that sits in the central brain called the substantia nigra, leading to Parkinson's symptoms and the symptoms that my father would ultimately die from, the label progressive supranuclear palsy. Again, I've got no doubt that my father was being poisoned from mold throughout his career and in our home. Ochratoxin A, another one. I'm just showing you all these different toxins, same kind of thing. Damages the lipids, inhibition of ATP, which is cellular energy, and ochratoxin does that. Mycotoxins interfere with endothelial function. This is the lining of the blood vessels. If it interferes with the lining of the blood vessels, that is one of the starting factors for coronary artery disease, vascular disease, valvular heart disease, and even atrial fibrillation, cardiomyopathy, erectile dysfunction. Scary stuff, people. This one here, again, zearalenone decreases nitric oxide production, 2017. Cardiotoxicity of patulin, cardiotoxicity induced by T2 toxin in rats, cardiomyopathy. So again, as you've been told that no one knows why you have atrial fibrillation, no one knows why you have cardiomyopathy, no one knows why you have high blood pressure, no one knows why you've been told, or no one knows why you have abnormal cholesterol. This is one of the factors. And it's a problem because people are not getting told. Now, again, what do these toxins do to your brain? Gliotoxin damages the blood-brain barrier, which means things get into the brain that don't belong. Gliotoxin is immunosuppressive. Other things damage the blood-brain barrier in the mold mycotoxin arena. All this brain fog that people have, cognitive disorders, or even dementia. Or we talked about the Parkinson's issues as well. These people need to be tested. Brain damage and neurological symptoms induced by T2 toxin, blood-brain barrier effects of Fusarium. And this one here, Fusarium leads to heart rhythm problems, autonomic issues as well. We talked about, again, we're high blood pressure, low blood pressure, high heart rate, low heart rate, other autonomic issues that can be diarrhea, constipation. It could be flushing that people experience. Any other kind of digestive issue, any kind of cardiac issue, any kind of pulmonary issue as well. Stachybotrys. This is the nasty black mold, direct and reflex cardiovascular effects of these particular mycotoxins. When you inhale these in the mice model, it showed that it led to pulmonary hypertension, high pressure in the rodent's lungs. I assure you, if we are getting exposed to this particular black mold, it is not doing us any good. And mycotoxins and inflammation, again, everyone knows that inflammation is bad. The cardiologists know that inflammation is bad. And check out the study from 2019, the IL-12 cytokine family in cardiovascular diseases. Because of the pro-inflammatory effects of IL-12 cytokine on immune responses, the IL-12 cytokines have been implicated in the development and progression of cardiovascular diseases such as atherosclerosis, but also heart attack and stroke. So I want you to remember this. Again, what they're telling us here is interleukin 12 leads to cardiovascular issues. Wouldn't you know that there was a study done in 2015, environmental mold and mycotoxin exposures elicit specific cytokine and chemokine responses. Okay, so what they're saying here so far is that the mycotoxins lead to interleukin elevation. So I told you IL-12 is bad. This study showed that people who were exposed to the mold mycotoxins had over 1,100 times more IL-2 in the mold exposed group. Over 1,100, specifically 1,137 more IL-12 in those who were mold exposed. And IL-12 leads to cardiovascular disease. The answer is not what pharmaceutical we can take to get rid of IL-12. The answer is get rid of the mold mycotoxins that are stimulating the immune system to produce this nasty interleukin 12. And again, here's oxidative stress markers, the rusting of the body from the journal in 2021. Now, this gentleman here, this guy came to see me a few years ago, super good fella. I can honestly say that he is a friend. He was just out in Colorado, and I had dinner with him a couple of months ago. And he came to see me, atrial fibrillation, obviously overweight, just not feeling good and not happy with where he was. And one of the things that we found in him is that we found the mold mycotoxins. And then we had him go back to his home and hire a company to investigate. And they did. They investigated where the mold was coming from. They remediated the mold issue. And he went through intense detoxification programs with us. And what can I tell you? I'm going to show you his after picture right now, and there he is. He looks like Iron Man. Now, again, he follows eat well, live well, think well, and then we did test, don't guess. We found the mold mycotoxins and other things, and then now we started on a plan to reverse all these things, and there he is now doing just amazing. He is absolutely a new man. So, okay, I know you're out there and you say, okay, I understand that mold mycotoxins may be responsible for many of my health issues. Again, I just gave you a ton of science. I would encourage you to watch this again, to really digest this, show it to someone who you love, show it to friends, family, colleagues, show it to your doctor. Show it to your doctor. I just gave this presentation to 2,000 healthcare practitioners. And again, these are holistic practitioners for the most part who understand that it is this is an issue, and I was there to demonstrate what it does for cardiovascular. So the question, of course, a lot of you are asking is, well, now what? Now that you told me that mold is bad, now what do I do? And this is where, again, we talk about test, don't guess. So we use a company called Vibrant, and the Vibrant mycotoxins test, it's a urinary test. They look for 31 of the most common mycotoxins produced by molds to which humans are exposed. So we talked about that there are over 300 known. Well, they test for 31 of the most common. There's other companies, there's Great Plains Labs, there's other companies that are doing this, but not to this level of how, again, Vibrant is doing it. So again, they've got proprietary technology, state-of-the-art laboratory. I've been out there in San Francisco. It's very, very impressive. They're able to detect some of the smallest mold mycotoxins that other companies couldn't even dream of testing for. And now, ultimately, we find the mold mycotoxins in you. And then what do we do next? Here's a sample copy of just some of the things. And ultimately, what we would do is we would find these in you. You would therefore, and then we would come up with a plan to get these toxins out of you. And then we retest down the road, maybe 3 months, 4 months, 6 months, whatever we decide to do. Each one of you is an individual when you're dealing with us over at Natural Heart Doctor. So ultimately, we test, don't guess. And when you do this Vibrant mold mycotoxin test, review with a Natural Heart Doctor coach, we come up with a customized plan for you. And then again, ultimately, we would retest in the future. So if you're interested in this program, all you have to do is click on the screen where it says click here. It's going to open up another window and you can review it now, you can review it later, but please review it. Please understand that mold mycotoxins could be seriously damaging your health. Maybe you have symptoms, brain fog, lightheadedness, dizziness. Maybe you don't have symptoms, but your blood pressure's high, or you've had a heart attack, or you've been told you've got coronary artery disease or coronary calcification. Again, this is where test, don't guess comes in. I've seen so many people that swear, I don't have mold. How would you know? How would you know unless we test you? How do we know how you're being impacted? I told you that mold mycotoxins and mold can hide inside of your laundry machine, can hide in the garbage disposal, in the cracks of your sink, anywhere in your house, in your bathroom, under showers, under toilets, under the sinks. They can be anywhere and everywhere. So again, please understand, test, don't guess. Review with a Natural Heart Doctor coach. We come up with a customized plan. We retest in the future. So you can do this as a standalone test. It's also inside our triple toxin test package. It's also inside of our level 2 testing. You can find it in there. So that is my presentation on mold mycotoxins and cardiovascular disease. I want to thank you so much, everyone, for watching, and I wish you the best in heart health now and going forward. Now the chat box is open. Feel free to jump in, say hello, tell me how you're doing. And again, happy to answer any questions. Go ahead and fire away. And again, I appreciate all of you for being on this call. Very exciting topic for me to be able to discuss again with everyone. So go ahead and jump in. Feel free to ask any questions about mold mycotoxins, about your symptoms. Lizbeth said, I'm one of the winners of the test from February, did the test and excited to get the results. Yes, you should be excited to get the results because it helps in so many different ways. So I'm excited for you, Lizbeth, to get the answers that you need. So there you go. Dr. Patrice, learning is power. No doubt. Dr. Patrice, you've been around for for a little while as well. So it's interesting. The more we learn, the more we realize we don't know a lot. But this is very exciting to be able to help people with this here. So Pam Brown, okay, to start with this, even though I'm planning on having an appointment with you about my heart. No, Pam, let's talk first, okay? Brad, how do I test for mold in a vehicle? Again, we can test you. The other test you can do, Brad, is something that we have, and you want to talk to one of our people. It's a test from a company called Envirobiomics. Love to talk to you about that. Tamara, does it cause nausea? Yes. Rena, the test price, again, the price on the test is $457, and that does include the review call with a coach, where the coach comes up with a customized plan on how to help you. Yes. And again, Barb and Tim, hey, certainly if you think symptoms are going on, if you think something's different, Tim, obviously I know a lot's happening with you. It's always good to get tested. A lot of people, get tested and they don't do enough about it, which is really a problem. So there you go. Jane LeBrun, you had mold. Jeff Mann, thank you so much. And Evora Baker, still processing. Don't have any questions now. Thanks. My husband is participating in the 100-Year Heart Challenge starting tomorrow. Yes, the 100-Year Heart Challenge. Cannot wait. Dennis, yeah, it's again, you can ask your doctor if they know about it, but whatever. Karen Anderson, after testing, I'm doing another set of CellCore supplements to get rid of my mycotoxins. Yep, there you go. Brandy, would you mind expanding on the sarcoidosis patient, how you work together to resolve that? Well, Brandy, he's been a patient of mine for several months, and we're still in the early phases of detoxification. I know he feels well, and we are slowly working on reducing and eliminating a lot of his pharmaceuticals, and then time will tell how we improve. It's a little early for that. I'm very confident that we're going to be able to help him. And again, he's already feeling better. And anytime we can start marching people off of pharmaceuticals, it was a very exciting aspect for me. JC, I work in construction, and we had a mold remediation. Construction workers, people that renovate homes, they know about mold. They've seen it. They've witnessed it. They know the severity of it. It's a problem. Chantal, does this work for chronic AFib? Well, again, there are many, many, many causes of chronic AFib, Chantal, and we need to find out what caused the AFib. We may not be able to resolve the AFib, but whatever caused it, what else will it cause? That is the problem. It's, if all you suffer from is AFib, that's not the worst thing in the world. But what is the possible next foot to drop on that? Brad, I currently have AFib and done the AFib labs. If I came to you, would you need my medical records? Yeah, of course I would want your medical records for anybody who comes to see me. So I'm not really sure what you're asking there, Brad. I definitely would like your medical records. Your doctor is not going to care. So sometimes I think people are concerned, hey, what will my doctor think? Well, your typical cardiologist is very busy. They're not going to, again, hear about anything. Oh, someone requested your labs. You sign the medical release forms. My team gets those records, and then you and I get to review those together and come up with a comprehensive treatment plan for you. So that's about it, ladies and gents. I've gone 50 minutes. I told you 45 plus Q&A. And, don't forget, if you have any questions, please feel free, email us, health@naturalheartdoctor.com, health@naturalheartdoctor.com. If you'd like to join our Facebook group, join our private Natural Heart Doctor Facebook group. If you don't want to be on Facebook, if you're not on Facebook, I totally understand. You can also subscribe to our YouTube channel. And, our goal at Natural Heart Doctor, for myself, Dr. Lauren Latanza, all the coaches at Natural Heart Doctor, all the team at Natural Heart Doctor, we're here to support you on your 100-Year Heart mission. And I wish you all the best this evening and beyond. I'll come back with more information, more research, more exciting things to help you on your 100-Year Heart. Again, I wish you all the best. Take care. We'll see you all next time.